So that's the objectives for this morning. We're going to be my name is, I should have started this first, I'm Jackie Dennis, I'm a Senior Improvement Advisor with the Care Inspectorate, and I'm currently redeployed to the COVID Flexible Response Team. So this team is due to finish in about a week's time as we, the Care Inspectorate, are really getting back to business as usual. So this session is particularly relevant to people working in care homes that are not primarily older people. It's more about adult services. And we do recognise that everybody's really tired at the minute, and everybody's had quite the last 18 months, quite a hard time. But we're really grateful, and for all the work that you've done, and for being very open in anything that we've been doing from a COVID response team point of view. And we're really grateful for the work that you've done. We've called these webinars Right Choice for the Right Reason at the Right Time, and hopefully that'll become apparent as we move through this. Because as you know, the guidance is changing quite a lot at the moment as we move back to business as usual. There's really not a lot of hard and fast rules. The guidance is there to help us. Like I said, it's guidance. So you really are going to have to apply, and using that kind of analogy, the right choice for the right reason at the right times will help inform your decision. And as we move through the presentation, what you'll see is that's the kind of approach we've taken when we share some of the findings that have come up over the last 18 months, well, primarily the last 6 months of our last inspection year. That would be October 20 till the end of March 2021. I have to stress here, what you'll hear is more based on higher risk services. So you'll see this is a smaller amount, but we still thought it was useful to share with you the key findings that are coming out for them. And the real aim of this session is to share the learning from them, and hopefully what you'll take back is to your services is when we share what we've been finding, ask yourself the question, could this be happening in your service? And if it is, then go back and have a look what your practices and what your systems and processes are. And during the session, we'll highlight where you can find really good practice that will help you to meet these requirements should they ever be made. So again, it's really about sharing learning. It's no teach granny how to suck eggs. It's not about sharing all the negative stuff, because we know there's lots of really good practice going on out there. But we just thought it was really important as a COVID team that we pull together these findings and then put it back to the sector and prep for us getting back to business as usual. Next slide, please, Lindsay. So I'm a numbers gal, and for me, a lot of the COVID detail is reflected in the Public Health Scotland website. So you'll see here on the left, we've put links to these sites here for you, and when you get the presentation, it will take you directly in. If you've never accessed these sites before, it's a really good place to find information around transmission, around age grades, demographics. Because if you look at it, the highest transmitters, or the people who are spreading COVID at the minute, is sort of in your 25 to 44 age group. And if you think about it, and if you look above and below that, the age ranges are the types of age ranges that are working across health and social care. So again, it might help inform your thinking of things. If you're working in a service where there's a high rate of transmission or a higher rate of spread, you might want to refresh staff memories around certain aspects of their practice. You might want to introduce other quality assurance measures based on this. And I'm not saying it's the be all and end all, absolutely not. But it just gives you an indication of what's happening, where your service is sitting, to help you think, is there something that I need to have another refresh with the staff on, or is there something else that might help me to reduce risk even further? So these are fantastic sites if you like numbers, and if you like to look at what's happened just generally over the piece. And again, it will just help inform your decision as we get back to more business as usual practice. Next slide, please, Lindsay. So what we've got here is this is probably the bit that you're most interested in. These are your high level findings from 47 inspections that was taking place over 10 services. And you're probably sitting there thinking, oh, that's only 10 services. But if you look at it as 10 services, but we've had quite a high intensity input into these 10 services. If you really look at it, 47 inspections have been undertaken, and we've made 34 requirements. So for a small sample, it's generated quite a lot of really good information that can help you look at the practices within the service and again link that back to your systems and processes. So the 7, it's obviously taken from key question 7. And while we're in a pandemic situation, then we will continue to use key question 7 as part of our inspection processes. But that's not to say you know about the care home IPC manual, you know about the cleaning schedules attached to the safe environment stuff. It won't stop you from doing that, because again, if you're in a service that's never had an outbreak or is deemed lower risk, although we'll still, if we start to get back to business as usual and coming back out to see services, if we're in a pandemic, we'll still use key question 7, but be prepared for that natural transition to the use of the care home IPC manual when it's declared the pandemic is over, or when we get word that we should be switching to using that. And obviously that will be communicated with you via our provider updates. So that's the 7 key areas that we picked up from the 47 inspections, and it was around monitoring of people's needs and addressing concerns. And Lorraine will cover in a minute what that means in real terms. You know, it's okay identifying that people's got a need, but then what you'll hear from Lorraine is it's that escalation process to get the person the help that they need. And we know there's been issues, it's already been discussed when we did this session yesterday with older people around, you know, where do you get the services, what if services are not available, that type of thing. But again, it's not about, Lorraine will cover some of the ways and how to address that. Obviously, infection prevention and control featured a lot. Key question 7 is built specifically for that. And as you can imagine, we have picked up quite a lot across all adult services and older people services, obviously. And with the introduction of the care home IPC manual and the safe environment cleaning schedules, again, that will help you address. Again, it will become your Bible eventually, and I know there's a lot of anxiety around it, but at the end of the day, it will be mandatory. So if we can help in any way, and you'll hear from Lorraine where you can find information that will help you, then, you know, it's about making sure staff are prepared for this natural transition. We're still finding issues with PPE. And I should say, although this is highlighted from October to March, our last inspection year, we have looked at some of the findings that are coming up from inspections that have taken place in this inspection year that started in April, and we're still finding similar things, so it hasn't gone away. Obviously, the safe, clean and a well-maintained environment and equipment. As you know, there was a review of the quality framework, so a lot of this has been woven into the new quality framework that will be getting launched later this year. So again, it's really important that we don't take our eye off the ball as we move back to business as usual and people think we're getting back to normal. We have to work with this in not just a COVID sort of bubble. We have to look at it that there will be other infections coming up as we move into the winter. And again, it's how do we manage that and how do we support you get the information that you need. So again, keeping the environment clean and well maintained will be absolutely key to that. So again, Lorraine will cover that when she gets on to her part of the presentation. And the quality assurance systems, again, if you look at it, if there's any issues that are being raised around some of the things around environment, staff practice or whatever, that is where it should be picked up via your quality assurance systems and via peer review when people are working together. So Lorraine will cover that in a wee bit more detail as well. And again, it's about IPC and cleaning of equipment. We know there's issues out there with staffing levels, but as I said, when our inspectors are inspecting, they are looking at that. And we're obviously using the safety huddle information as well. So that's one of the top 7 that came back up for adult services as well. And although we've used ineffective management there, that covers a whole raft of things, and that's just the wording that's in the guidance or in our framework at the minute. So again, Lorraine will cover that, but it's not just about management, it covers leadership as well. So from our perspective, these are the things. So again, putting it in context, these are 10 services out of 250 care homes that are specifically registered for adults only. As you know, we've got over 1,000 care homes in general, so this is just a small part of the work that the Care Inspectorate has done in these care homes for adult services. So again, it's context, but we shouldn't ignore it either as we get back to business as usual as well. So I'm going to hand over to Lorraine now, who is an inspector, and she'll introduce herself, so I won't steal her thunder. And she'll take you through some of the more detail that's linked to these 7 key things that's been picked up during inspections. And again, please use it as a way just to think through, is this happening in my service, or could it happen in my service? And if it is, take away from today where you can get help to help you meet that. So I'm going to hand over to Lorraine.
Thanks, Jackie. We bit echoed this morning there. Hi everybody, hope you're okay on this Wednesday morning. As Jackie said, my name's Lorraine McDonald. I'm an inspector and I've been redeployed to the COVID team, and I'm heading back to inspection really quite soon, in less than a week now. Crikey, I don't know where the time's going. Now, what I plan to cover is our findings from high levels of inspection. Just certain things that we picked out, as Jackie said, might be good to you, might be helpful, might be useful in looking at your own practice within there. They're all from KQ7. Now, during my last presentation yesterday, I spoke far too fast. So please let me know if I need to slow down, or if you need anything clarified, please use the chat and somebody will give me a nudge if I'm ranting away at stuff. What I'm trying to do is highlight some of the areas that have tripped people up in the past and tripped services up in the past. And the aim is, as Jackie said, not to teach you granny to suck eggs. It's just getting you to think about, well, other services fell into this pitfall. Could this happen in our service or not? Next slide, please. Okay, the first set of slides are from the requirements made round about the quality indicator 7.1. That's people's health and well-being. Has it been supported and safeguarded during the COVID-19 pandemic? Okay, so we're looking specifically at monitoring people's healthcare needs and addressing concerns identified. The issues that we found were in relation to nutrition, hydration, skin integrity, mobility, and stress and distress. Now, although a number of these concerns were a direct impact of people developing COVID, there were a significant number that were as an indirect consequence of COVID. That is such as where people's service delivery had to be changed. Physical isolation, you know, at the beginning of the pandemic, a lot of people were obviously in shutdown. A lot of residents spent numerous hours in their bedrooms, and that's had a major impact on people's health and well-being. And that's been compounded by the lack of contact with family and friends as well. Now, we know care home staff have been key over the past 18 months to ensure that people receive the right care at the right time. And your assessment skills have been crucial, basically. However, we found that where the problems have been identified, there was sometimes a breakdown in any follow-up action that was put in place. Therefore, it's important that there's a plan of care in place and that is implemented fully. Now, if somebody has refused care or the care has not been given as planned, then it's important that things are escalated appropriately, and we found that's been the issue. Staff know there's an issue roundabout or a need roundabout, say, nutrition, hydration, but it's the next step as to what's being done about it and whether or not things have been moved on, whether it's been reviewed, whether or not action's been taken quickly enough to prevent any further deterioration. So it's important that people look and assess individuals as a whole, determine the picture, look to see if the care planned is effective. If not, start again and get the professional help out there. You know, there's a whole host of visiting professionals that can come into your service, they should be coming into your service to review people's care and support needs out there. It's a whole team approach. That's not just a team, your team within your service, but a whole health and social care partnership team as well. But in general, within your service, whole team approach to ensure the consistent practice, make sure everybody understands what they're aiming for to try and achieve with that person that you're looking after. Now, there's lots of good practice guidance out there, and A lot of it can be found on our Care Inspector Hub as a central point for you, and you'll find lots of good documentation in amongst there. So please use it. It'll give you a guideline as to the direction forward. Next slide, please. Okay, the next few slides are from the Quality Indicator 7.2. That's infection control practices support a safe environment for people experiencing care and also staff to safeguard them. Now, as you can imagine, because this was our focus during the pandemic and still is, by far the most requirements were made in regard to infection prevention and control. As Jackie mentioned, and I'm sure you'll know, the new infection prevention control manual cleaning specs were launched in May, and they're mandatory. We'll be taking them into account from the 1st of September. Having said that, we're still in pandemic, so the addendum still continues to apply up to now. Okay. Now, I know that particularly services, care homes for adults, differ quite a bit from care homes for older people, and that is usually the size of the service. And implementing the manual and the cleaning specs, although they are mandatory, can be a challenge for a number of services. And we're going to adopt a proportionate approach. We're going to look at individual cases as they arrive. But it's important that services that have an enablement function continue to do so. We don't want to lose that. However, it's as equally as important that the care homes meet the good standards of cleanliness that's dictated within these manuals. And it's the managers and providers' overall responsibility to ensure that. Now, I'm sure you'll find ways of embedding good practice guidance into practice in the way that you've embedded other legislation. For example, fire safety, food safety, and the COSH. The issues that we've found have all been in relation to the health and social care standards, which say that staff should be trained, competent, and skilled. And for the legislation, we're looking for training to be appropriate for people who work in the service to achieve the work that they undertake, so that the training meets their performance, if you like, what we should be doing. The issues came up around staff not completing training, especially e-learning training, the training being ineffective, that is either the training not being put into practice or not meeting competency levels. And sadly, it seems that some staff don't think that the training actually applies to them, particularly in the smaller services. We don't need to do that. Well, yes, you do. You should be trained to the level of the skills that you need for the job that you're undertaking. Staff being unaware of IPC guidance, whether that be the addendum, whether that be the care home manual, or whether that be the information guidance for care home settings out there. We also found specific issues in relating to PPE, cleaning of equipment and environment, hand hygiene, the management of waste and laundry. And as we continue to move through the relaxation of restrictions, it's important that the use of PPE is vital and used at the right time, as this will prevent the spread of infection. Now's not the time to be complacent, and I think some staff and some services have got their testing regimes in place. Staff have now been vaccinated, and that's embedded into culture. But COVID's not going away, and we all know that having a vaccine doesn't prevent you developing COVID or spreading COVID. The only thing it does, it prevents or reduces the amount of how poorly you are, how poorly you're going to get. But it doesn't prevent you spreading it to the vulnerable people that we look after. It's important that staff remain vigilant. Now, there's a host of useful and helpful information training out there on IPC. I'm going to direct you to the TURAS site, which is the NHS site, and it's easy to register on for anybody at all to get in there, and they've got some really good information. There's the SSSC site, and again, they've got a whole package of stuff on infection prevention control, and also our Care Inspector Hub. We're going to share some of these links at the end of this webinar presentation, so keep your eye out for that, and they're hyperlinks, so all you need to do is click into them for there. Next slide, please. The correct use of face masks, the correct use of PPE. This is an area that keeps coming up and up and up again. Face masks are going to be with us for some time, as will physical distancing in some form or another. So it's important that staff wear the right PPE at the right time and that they wear the PPE properly. As I said, PPE will help reduce the risks along with other mitigating behaviours out there. The areas we're picking up in relation to poor practice are donning and doffing. At the start of the pandemic, staff were so hot on this and that was drilled into them. However, that's beginning to slip, but donning and doffing still remains vital, and it all comes back to ensure your staff are trained and ensure your quality assurance systems are in place in picking up poor practice then. Some other findings are fluid resistant surgical masks not being worn or not being worn appropriately. We've seen them below people's chins, hanging off of people's ears, tucked in people's pockets and then put back on again, people's noses poking out, that kind of stuff. Need to be aware the complacency is creeping in, and this again is where your quality assurance systems come in place to make sure everybody remains focused. Gloves, using the right glove for the right task. We're still finding quite a lot of polyurethane vinyl gloves out there, and specifically being used for personal care or in contact with blood or body fluids. There is a lovely chart available, which I'm sure you're aware of, and that's from the National Infection Prevention Manual. It's in Appendix 5, and again we'll put the link there, and it's a lovely flow chart. What role am I doing? What gloves do I need to wear? It's quite simple. But again, it comes down to staff becoming complacent and careless with their PPE. They don't think it matters now, but as you and I know, it is vitally important. Next slide, please. Okay. Services need to be safe, clean and well maintained, and that includes the equipment and the environment. This is divided into two parts that we looked at. Obviously there was equipment and there was environment, but the principles are plain for both. It needs to be clean and well maintained. Within the new Care Home Infection Prevention Control Manual, you'll have seen the section 5 refers to everyday cleaning in a non-pandemic situation, and it describes type of equipment out there. Basically, it's divided into 3 types. We've got single-use equipment, and that is an item of equipment that's used on one resident and then discarded. It should never be reused at all. So things like needles, syringes, all that are your single-use equipment. Then we've got single-use individual equipment, and that's equipment that is for use on the same resident but can be used a number of times. So here we're thinking about nebulizer equipment. You know, so if a resident has a nebulizer, you know, to clean and decontaminate the mask after use, but can be used again and again and again on the same resident. The next category is reusable non-invasive equipment, and that's your communal equipment, and that's equipment that can be reused and for a number of residents. So we're speaking about things like commodes, manual handling equipment, bath hoists, shower chairs, but it's important that we know how we're decontaminating them in between the use of that. Remembering that during the pandemic, the addendum still remains in place, but you need to be aware of what risk pathway your service is on, because depending on the risk pathway, it really depends on your actions and practices, as that varies between the high risk and the medium risk. So it's important that you need to work out what the risk pathway is on. Okay. The manual also contains a chapter on the safe management of care environment, which includes a link to the cleaning specifications that I'm sure you've all seen, you've all ploughed through, you've all scratched your head about how on earth we're going to implement that. Basically, all the cleaning schedules is giving everybody a framework and a standard of how clean services should be. Provides a structure for a cleaning, provides a structure for and a plan for cleaning. It gives cleaning templates for you to use. It provides standard operating procedures, and it enables you to look at your process for checking, i.e. your audit system, your quality assurance system, to ensure that your home remains safe, clean and well maintained. A number of issues are coming up to us regarding bits within the manual and also the cleaning specifications. And the first one is the use of chlorine releasing agents. When an organisation adopts practice that differs from these recommendations in the national guidance, the individual organisation is responsible to ensure safe systems of work are in place, and that includes a completion of a risk assessment, and that risk assessment should be approved through your local governance procedures in there. So we're saying chlorine releasing agents are the gold standard. If you're not going to use them, you need to demonstrate clearly why you're not using them and why you're going against the guidance, what you are going to use, and has that been discussed with your local governance procedures. The other one that's got a lot of people scratching their head is the use of, or the non-use of, non-refillable spray bottles. Okay, so we shouldn't be using non-refillable, we shouldn't be using refillable spray. God, get my teeth in this morning, sorry. We shouldn't be using refillable spray bottles, okay? And that's come from RHI itself. We're waiting for the literature review to come out on that. However, it's quite clear that we shouldn't be using them simply because it's a spray mechanism that can't be decontaminated properly. And when we speak about decontaminated, it's that spring bit in the mechanism. It can be colonized by other bugs. Now, if we're moving away to business as usual, moving away from the pandemic towards business as usual, how do we get on with life? Then we have to be thinking of other bugs out there, not just COVID. So if the spring mechanism is getting contaminated with other bugs, do we want to be spreading that other bugs around our service? So that's the rationale for not using refillable spray bottles out there. Now the next slide, please. Quality assurance with regard to your IPC and cleaning of equipment, and your quality assurance covers a wide remit within your services. We've already discussed it's almost the pinnacle to check that everything is going right within your service, checking how well you're doing, checking how do you know you're doing okay, and what can we do to improve that. You will have your own quality assurance process or systems in place, but are they doing what they say on the tin? Or are they improving outcomes, or are they just checklists? Is your auditing system continually showing up shortfalls around cleaning in your service? And how do we ensure that the system breaks and we start to see sustained improvement? And that can be a challenge. You have to review practice and human factors in amongst that, as well as the systems and processes in order to get to the hub of the matter. It's all about looking at what people do, not just looking at what systems in place. I've told them to do that, but actually looking at the person. Are they actually doing it, and why are they not doing that? What is the breakdown in that? The whole point of a quality assurance system is to determine whether or not you're meeting the agreed standards. And if you're not, using an improvement system is one way to help you determine why not, to help generate ideas that could be used to improve your systems and processes and people's behaviours. It gives you tools to review what you did when you did it, and it gives you a plan of what the next step will be. And that's your PDSA, and I'm sure you've heard us talk about that. That's your plan, do, study and act about that. It's a whole team approach, and that's what generates your improvement plan for the service. Now, if you're out talking about quality assurance approach and we look at the cleanliness, what are we asking you to do? What should we be doing? We're asking you to monitor and check. We're looking at observations of practice, spot checks, feedbacks, to identify any issues out there. We need you to involve your whole team because they're very good at coming up with ideas and how things will improve. We need you to put these ideas into practice, to monitor and look at what the next step will be, to change the approach, review it all over again. Staff generally know what needs to be improved, but they need support to get there. You need to discuss it with staff. Ongoing assessment and review is vital, as is observation and assessment. These are vital to ensure that any improvement is sustained in services. That goes for any aspect of your business, but in this case we're particularly speaking about infection prevention, control, cleaning and equipment. Next slide please. And finally, the next two slides cover the quality indicators in 7.3, which is about the staffing arrangements and being responsive to the changing needs of people who are experiencing care. Now, as you see, the legislation states that there should be suitably qualified staff in such numbers where appropriate to meet the health, welfare and safety of the service users. So we're not just speaking about direct care staff, we're also speaking about domestic staff, ancillary staff, as they are also key to making sure people's well-being needs are being met. And this is this is important, but more important is we're asking people to up the ante the whole time about cleaning, make sure people's welfare, well-being is established. So thinking about that. As you know, there's work ongoing just now by the Safer Staffing projects out there, and that's come about following the Act of the Health and Social Care Staffing Scotland Act in 2019. So there's lots of information out there about safer staffing and staffing levels out there. I know it's a difficult one for you because I know staff retention's a lot, and that is in high focus with the SSSC ourselves. We've got the TURAS figures we're looking at, so we're not ignoring this. It is important, but there is no magic wand to it, and we're trying our best, hence the Safe Staffing project. Next slide, please. The final slide that I want to look at is, I've labelled it as ineffective management arrangements, and that sounds quite scary, but basically it's not just about the managers in the service, but it's how services are led on a daily basis. And this is what's tripped up a number of services within the past requirements that we've looked at. It's all about ensuring that robust systems and processes are in place to ensure that the delivery of care is well supported and any concerns are addressed quickly. We all have a role to play in this. All staff also have a role to play in this. Whoever's on shift at the start of the day has a role to play in this, but the managers are vitally important. You will be aware that the registered managers requirements were published in June of this year, and that covers what is expected of those who are appointed to manage services. What the Care Inspectorate look for is managers are generally expected to have a qualification of an SCFQ level 7. Why do we ask that? Basically, it's because managers provide a level of leadership for staff and ultimately make decisions regarding the service delivery, the competency and the fitness of staff. And we believe that the managers having the relevant practice and knowledge to fulfil the role is a reasonable expectation. Saying that, what we found in the requirements we made around about ineffective management arrangements and services were poor communication, both internally and externally. Nobody was speaking to each other, okay, or everybody else thought somebody else was dealing with the problem. Limited understanding of roles and expectations of the manager. Again, that's not my role. I thought somebody else dealt with that. Ineffective monitoring of practice and outcomes for people. the quality assurance system not doing what it says on the tin, or not being implemented fully, or being a tick box exercise and not actually looking at how can we improve the outcomes for people here. The lack of oversight of those people who are being assessed as being vulnerable. And in amongst that, I'm speaking about the adult support and protection scenarios round about here. An example is, you know, if something goes wrong, a carer goes in for a regular visit to somebody, or person's not in, or somebody's, you know, a resident within your care home, their behaviours, their actions have been significantly impacted because of COVID, and that's not reported up the line to get help, to get guidance, to get reassurance. They may have increased stress, distress, and staff are trying to deal with that on their own, as opposed to addressing that through the adult support and protection procedures, so we can get professional help in to help you there, because there is support networks out there. So in summary, these are some of the high level findings that we've found. Most of them were specific to COVID-19 in the guidance, but others were wider, and it was more about service delivery than the COVID itself. Now I'm going to hand you back to Jackie, and who's going to finish us off, but hopefully that's been okay. Back to you, Jackie.
Thanks, Lorraine. Next slide, please, Lindsay. So Lorraine gave you a kind of whistle-stop tour of some of the detail that we picked up as part of our inspection processes. This is where she made some reference to some of the things that you probably know about, but it's just worth recapping. As we've moved through these, moving back to business as usual, the guidance is changing rapidly at the minute, and there's more changes to come. We at the COVID team have been responsible for picking up on these things, but like I said, the COVID team is ending, so we're going back to a substantive post. But before we go, from a care inspector point of view, we will put in processes to make sure we're still monitoring guidance that's coming out. We will be updating frequently asked questions and our compendium, and you'll still be able to find them on the care inspector website. And it's a one-stop shop for you, really, where you can go in and click on links, and you'll be able to search by adults, children, young people. So we've broken it up to make it ease of access for services. It will dip in and out of these things. So if in doubt, if you can't find a piece of information or guidance, you know, if you go into the care inspectorate, go to the frequently asked questions or the compendium, the links will be there for you to use. The sites that we tend to use most or get our information from is Public Health Scotland, TURAS or NES, and we also use the Scottish Government websites, again, when they're publishing their guidance. So when you see the provider updates coming out, we've usually got that guidance, and that's what's going into the provider updates. And again, we'll keep it up to date as best we can, but we cannot stress enough that at service level, if you're not doing it already, have somebody go in and check that on a regular basis, especially now as we're moving towards level 0 and beyond, and the guidance is changing around, you know, physical distancing, the practices, the IPC practices, depending on what risk pathway individuals are on, as well as the identification of whether you're COVID, non-COVID, suspected or whatever. The guidance is changing to support you to do that in a very sort of proportionate way. Because like I said, you're probably aware anyway, we have to learn to live with COVID, but it's not just COVID. We're heading into winter. I know that's a sad state of affairs considering we're still in August, but it's about planning ahead. If you've never had an outbreak, please be outbreak ready, and you'll find on Public Health Scotland's website, there's a fantastic tool around the outbreak management. So again, don't become complacent. You know, even if you run some updates with your staff to make sure they know where to go and get this information should they need it. It's all about responding and responding well and responding quickly if things untoward happen within your service. It's knowing where to go and get good information that will help you manage the sort of other impacts of COVID or other infections or pathogens that may affect you over the coming months. There's, like Lorraine was saying, there's fantastic information available on the TURAS site. So if you don't have an account, and I'm reiterating that, please ask your staff to get one. And again, use that information to support you. But like I said, these are the three main websites that we tend to use, and really they're kept up to date, and the speed of change at the minute, like I said, is fast. So please get into the habit of checking these sites for yourself and get ahead of the curve, because there's things always happening on it. Next slide, please. And that's just a summary there. When you get the presentation out, they're all hyperlinked for you. So again, have it sitting somewhere if that's what you want to do, and that will help you access information really quickly when you need it, and it covers the things that we've spoke about this morning. And you'll find in there we'll put the Building Better Care Homes link as well, and as you know, that's under review at the minute to incorporate some of the things that were picked up over the last 18 months as a regulator, but also to build in, like, obviously links to the Care Home IPC manual, the Safe Environment Cleaning Schedules, the TURAS where you can get information. So again, this will again be another Bible, I think, along with your Care Home IPC manual and your Safe Environment guidance going forward. And to reiterate again, while we're in the pandemic situation, we'll be using the addendum until we're told otherwise not to, and again that will be communicated. But if the pandemic is declared over, then there should be a natural transition into using your Care Home IPC manual. Whether that's at the 1st of September, if we're still in a pandemic, then no, but if it's a bit later, it's about watching that and making sure at the moment you're using this time to get people up to speed with what's in it and how to use it. And prep for it becoming active. Next slide, please. So take-home messages, like I said, they're the IPC addendum. It will stay in place until it's declared over, the pandemic's over. There'll be that natural transfer. Can't stress enough, be outbreak ready. But referring back to the slide I showed you at the beginning around the statistics around the age groups that are the highest transmitter of COVID at the minute, and again, like I said, it's primarily in that age group that are working across health and social care. Just be outbreak ready. Go in and have a look at that outbreak checklist. Make sure you know where to go and get it really quickly, because it really will help you to close things down at speed to prevent any longer. If make sure you know what to do and when to do it. It's back to that whole the right choice at the right time for the right reason. It will help you to work through that, who you should be contacting, what you should be doing, and prep for something unfortunate happening. Please prevent complacency creep, and that goes back to your QA approaches. Go back and have a look at staff practice. Really, it's human factors that are driving this, and I'm speaking to the converted. I know you'll be aware of this, but I make no apologies for saying it. It really is about hand hygiene. It's about cleaning. It's about wearing your PPE appropriately. It's about being conscious of what you're doing. And there's a thing that's coming out that's about being able to challenge each other, positively challenge if you see any of your colleagues doing things that they shouldn't be doing, or it's not in the spirit of the guidance. So there's something, there's a campaign going to be starting soon around that as well, just so that, again, it's to reduce the likelihood of complacency creeping in. And again, like I said, use the statistics, use those public health websites to just keep a wee eye on what's happening locally where your service is situated, because again, that might help inform your decision making about what kind of things you might want to revisit with staff, and keep doing it routinely and regularly, so that again you're keeping staff up to date, you're keeping them focused that we're not at the pandemic yet, and even when we do come out the pandemic, it's about maintaining all that good practice that you've put in place to prevent any other sort of pathogens taking hold, or any other pathogens that might be affecting outcomes for people as we move into the winter, and that could be your norovirus or your flus. And we recognise, with the best will in the world, things will happen, but it's just been making sure everybody's absolutely clear what they should do and when they should do it. And again, I won't labour the safe environment point, but again, it is involving your ancillary staff, whether it be laundry, domestics, your maintenance men, making sure they are kept up to speed, because I have to say your domestic staff will be absolutely key in the safe environment and cleaning schedules approach. So just be vigilant, and just remember COVID hasn't gone anywhere. and it's about thinking bigger than COVID now as we move into the winter. We're living in a COVID bubble at the minute, but as practices change, and you've probably picked up, you know, the guidance around physical distancing between relatives and their families, and you know, that's definitely moving in the right direction. But again, it brings with it its own risks. So it's about remaining vigilant and making sure everybody's aware what they should be doing and when they should be doing it. So next slide, please. So that's it. It's been a really quick overview of the key findings that we've had and where you can get help to help you meet those requirements. The chat's been really quiet. There's been very little put in the chat. So if you've got any questions, now's the time to pop them in. You know, if there's anything burning or anything that you think we can help you with, like I said, if you don't know the answer, then we can pick it up. But other than that, I've given you 13 minutes of your life back. And thank you very much for attending, and thanks very much for listening in, and hopefully it's helped. There's a self-evaluation going to be put in the chat shortly, and we really would appreciate your feedback, because we're always looking to improve ourselves as well. If there's anything that's not hit the mark, we'd love to hear from it, or if anything you think that's really been good about the presentation, then we'd love to hear that as well, and then we'll keep it for future presentations. So again, please take the time to fill the evaluation form in, because we really do use them to help us plan for future sessions. So thank you very much, and have a really good rest of your day. Thank you.
Thanks, Jackie. We'll just give it a minute just to paste in that evaluation link into the chat, and everyone can, if you could please try and do that. But if not, don't worry, we will be sending this out in an email to you along with the slides in a few days' time.